My name is Paula McTaggert. My husband's Bill. I'm a registered nurse, and my husband's a paramedic. He has over 25 years in the field, and we have a son, David, our youngest child. And in 2005, we went on a vacation to Texas, and our son was jumping up and down on a mattress, fell, hit his head on a brick, fire earth, and injured his head. But there didn't seem to be a whole lot more going on with his injury other than, he had a little bleeding. We fixed that, cleaned it up, and went on our way. About a month later, our son started having seizures. So we took him to the doctors, and the doctors would just send us home with medication and tell us to go home, and if he had a seizure, take the medication. And this went on sometime, going to 2 different hospitals, to 2 different ERs. Again, we don't know why, but here's, take the medication, send him home. He went to a children's hospital, had a lot of tests done, still they had no answers. So again, it was here, take the medication. Well, our son was about 3 years old, and he was having 15 to 20 seizures a day still, even on the medication, and they put him on Topomax. And when they originally put him on the Topomax, we had to increase it 3 different times in 1 week, and still he was having seizures all day. So our son was either post-ictal, seizing, or on medication that was causing him to just kind of be in a stupor. 15 minutes a day I saw my son. The rest of the time, there was like nothing there in his eyes. Well, one day at work, another nurse asked me how my son was doing. And she asked me if he was getting better, and I said no, and I was quite worried because I had to come to work at nights, and I was scared that something might happen to him while I was gone, because his seizures happened frequently, and some of them were very long. We even had rectal Valium on our bedroom wall taped in case he had a crisis and we had to give him the Valium. Well, all through this, we kept trying to find an answer, but when my friend asked me if my son was doing any better, and I said no, she said, have you tried taking him to a chiropractor? And right then and there, I knew that was the answer. I knew. And so I made an appointment for him, and the morning that he had his appointment, he was still having seizures. We had one waiting for the doctor's office to open in a restaurant, and took him to the doctors. They took x-rays. They adjusted his back. That was on a Thursday. Between Thursday and Monday, he only had 2 more seizures. So that week I titrated him off the Topomax. He continued to see the chiropractor, and the seizures went away.
What level? What level on the neck?
C1. It was this C1 that was out of place. And we could see on the x-rays it was clearly out of place. No medical doctor even questioned this. No medical doctor even wondered about this. And he was seeing some of the best in the nation. He went to a very large children's hospital with a neurologist specialist, and still no answer. But after taking him to the chiropractor and having him adjusted and titrating him off the medication, the seizures completely stopped after those last 2. And the smile came back. The twinkle in his eyes came back, because when he was still taking the medication and he was still having the seizures, there was no sparkle in his eye like a small child has when he smiles. There was nothing there. And even for some time after, that twinkle wasn't there, but after time it did come back. And I know it's because of the manipulation that he had in his back. I know that was the answer, because the pressure that was on his spine was causing the pressure on his spinal cord was causing these seizures to trigger. And having his adjustments changed that, so he no longer had that. And he was a normal little boy again. He wasn't doped up on medication. He wasn't seizing all day. He wasn't post-ictal all day. And I wasn't scared to death that my son might die from complications from a seizure while I was at work. So we're so absolutely grateful to find the proper doctors, and he's been coming to Dr. Frye's now over the last few years. And the changes, it's like night and day to have your son seizing all day long, and then coming in and having his back fixed, and the seizures to go away. And the Topomax has its own side effects, and no parent wants to see their child just looking like a zombie all day long. But now we have our son back after doing the manipulations in his back, and he's a normal little boy again. So I encourage anybody who has a child who's having seizures, take him to a chiropractor, have him checked. Because if it is from their spine being out of whack, then you've got a whole new world ahead of you getting them fixed. God bless.